it's interesting when you look at trigger points in myofascial problems in your body. The majority of trigger points occur in posture muscles that are primarily not power muscles but posture muscles. So glute max certainly gets triggers, but they're not as when they're there, they're very troublesome. And the triggers, there are actually 3 triggers. The first is along here, which is in the thickest part of the muscle. So the trigger occurs around this area. The second is in the free edge of the muscle. So here, there. And the muscle itself, as a lot of the big, powerful muscles of the body, it has a free edge, like the latissimus dorsi, like your pectoralis major. These muscles, and like the trapezius, these muscles have a free edge, which is just how the design goes. So the second trigger is here, and the third trigger is further lateral, like that. Now, this trigger sits over the sitting bone, the ischial tuberosity. And one of the symptoms of trigger points in the glute max is that it's really uncomfortable to sit, because this muscle gets squeezed onto, this trigger gets squeezed onto the ischial tuberosity. So the way you treat glute max, and glute max is, because superficial muscle, is actually quite easy to find find trigger points. The muscle fibers run in this way, they curve around, and so if you're searching for the trigger, you're running across the long axis. You're feeling, you'll find, because it's a big strong muscle, you'll find absolutely easy to feel little guitar strings. Once you find the guitar string, you search for the trigger, you'll feel it as a thickening, and then you will treat it. And this trigger gives you pain locally and comes across the sacrum. This trigger also refers up and down slightly, and the final little trigger over the ischial tuberosity is local. So this trigger you find by actually squeezing and lifting the free edge, and you find the trigger in the free edge. This you find by pressing straight down and in. The treatment is, if we were to choose any, we'll choose this: ischemic pressure, finding the point, pressing hard enough to cause pain, backing off. He's breathing and relaxing. I'm slowly increasing the pressure. We're in eye contact, and gradually, as I push in, the trigger just dissipates under my finger. This one squeezing between, that one pushing directly on.